good idea. A better idea is just to get as many people as healthy as possible so that the MDs die by attrition. I mean, they're already killing themselves. They're already committing suicide. I'm not going to say that's a good thing, but it's a telling thing. That the profession that you go to for advice about how to get healthy has an inordinately high rate of suicide. And you're going to go to these people for advice. They also have amongst the shortest life expectancies of anybody in the United States, and you're going to go to these people for advice about health. It's a fool's errand to do this. You know, like Sherlock Holmes said, Arthur Conan Doyle, the easiest place to hide something is in plain sight. So just take a look around. Take a look at the health of your MD. Is your MD healthy? Does your MD look healthy to you? Ask your MD how many prescription medications are taken. Remember, somebody's health is inversely proportional to how many prescription medications they're taking, because health, from the real definition, a sophisticated, clinically based definition, health is the ability of a living organism to experience stress and remain symptom-free. So the job of the physician is to bring the patient back into a state of health. And anybody who is on a prescription medication, by definition, is no longer in an optimal state of health, because if they were, they simply would not need the prescription medication. So this is our goal. This is the brass ring that we're trying to grasp, a prescription medication-free life, as a life where our mood, energy, appetite, sleep, sex drive, everything is optimized as much as is humanly possible without the advocacy of prescription medications. Let's go to Utah and talk to Lillian. She's been waiting patiently. Hey, Lillian, thanks for the phone call. You are live.
Hello, Dr. Glidden.
What's going on, Lillian?
I'm fairly new to longevity. Heard Dead Doctors Don't Lie a long time ago. But my daughter went to an eye appointment this morning, and the eye doctor said that she's got, he could see something, so he sent her down to the doctors, and they did a sonogram, an ultrasound.
Yeah.
And he said she's got massive swelling behind the eyes on the optic nerve, and they're going to schedule an MRI. They said it could possibly be a pseudotumor cerebri, but they won't know until they do that MRI.
Yeah, and, pseudotumor cerebri means, a swelling in the skull. It's fancy schmancy doctor talk for swelling in the skull. There are a number of things that could cause this, of course. How old is your daughter?
Oh, gee, 30.
Okay. And is she open to, doing a medical nutrition intervention?
Yes.
She is. Okay. Yes. So what we do for everybody, especially if that person is dealing with, a chronic or an acute illness, and this is kind of somewhere in a gray area between those two, because if this is in fact a thing, then it doesn't happen, because of a viral infection, right? It happens because of the straws that have been breaking the camel's back, that have been building up for a long time, and then all of a sudden she wakes up one morning and she's got this, and it really was the result of, months or years of stress buildup in the body and the inability of the system to be able to deal with it and handle it. So what we do here is advise that people stop taking food into their body that is harming the body, that's causing undue amounts of stress to the body. And so we've determined there are 10 foods that do that. So the recommendation here is for people to clean up their diet and to eliminate the 10 foods that hurt the body every day. You can get that list free on my website, drglidden.com. Go to drglidden.com. And it should be there right on the front page. If you sign up for my newsletter, look for the link to sign up for my newsletter. And when you sign up for my newsletter, you're given this information for free. Everything that stuff is free on my website. So she needs to stop eating 10 bad foods, and she needs to give her eyes nutrition as well as her body, right? Because everything's connected. So she needs to feed her body the nutrients that it needs in order to optimize its structure and function. Keep her fingers crossed and see what happens to the swelling in the optic nerve. Now, anything that's going on with the nervous system in the skull, it's a good idea for the person to see a chiropractor or an osteopath or somebody who has been trained and has experience with craniosacral treatment. Craniosacral treatment. Now, the best craniosacral practitioners have been doing it for more than 10 years. So you want to see if you can find in your neck of the woods a practitioner who's versed in craniosacral treatment, who's been doing it for more than 10 years. And craniosacral treatment manipulates the bones of the skull the same way that chiropractic manipulates the bones of the back. It can be a very useful adjunctive therapy to a medical nutrition strategy when people are up against neurological problems in the skull. It's a very pleasant experience, a craniosacral treatment, and oftentimes it can provide just that little extra oomph that the body needs in order to get on the other side of whatever the problem is. So the recommendation for a nutritional intervention here would be per 100 pounds of body weight per month, 1 Healthy Body Start Pack 2.0 liquid, 1 Healthy Body Start Pack 2.0 liquid, 1 bottle of plant-derived minerals, 2 bottles of Ultimate Selenium, and 1 bottle of Cell Shield RTQ, 1 bottle of Cell Shield RTQ per 100 pounds of body weight per month. Now, to that program, please add 1 bottle of Ultimate Daily Capsules, and advise your daughter to eat as much, to consume as many antioxidants as she possibly can get down the hatch. And she can do that with food. She can do that with supplementation. I wrote a chapter about that in my book. I've given webinars about how to get antioxidants into your body. The easiest way is to get Youngevity's product, Triple Treat Chocolate. Triple Treat Chocolate, 1 piece, and it's chocolate. Has over 19,000 ORAC points, and that's a really good start because the goal here is 100,000 ORAC points of antioxidants a day. So she could secure all of that by eating chocolate every day. Bummer, I know, but it really depends, on the budget and too many variables to predict. But that's the recommendation. Eliminate the 10 bad foods, 100,000 ORAC a day. Get on board with those supplements. And if it were me, I would run with this program for 90 days. I would run with this program for 90 days before I did anything else, and that includes the MRI. I wouldn't get the MRI. Remember, this is a holistic program, right? And that's more than just fancy New Age words, right? What this means is that everything in the body is connected. So if there's been enough stress in her life, and could be lack of nutrients, that's stress to the body, right? Could be eating all the wrong food, that's a stress to the body. I'm not talking about emotional or psychological stress. I'm talking about stress with a capital S, kind of like in a big umbrella. As undoubtedly, if she's experienced enough stress in her life to make the optic nerve funky, then there are other parts of her body that are funky as well, but she's just gotten used to them, like she's got really painful periods, or she has erratic periods, or it's hard for her to fall asleep, or she has heartburn 3 times a week, or she's got a chronic kink in her neck, or she's got something, right? Or usually with people in there, after they enter their mid-20s, it's more than one thing. It's not just one thing. They have a whole laundry list, but they thought, oh, that's just life. I just have to deal with it. So in the next 90 days, if she chooses to get on board with this program, I would have her pay attention not only to, what's going on in her eyes, but also what's happening everywhere else in the body. And the beauty of the holistic method is that once we get traction in a couple of different parts of the body, so you take the supplements for a couple of weeks and your energy's better, your sleep's better, your heartburn's gone, whatever. Once symptoms start to fade away, that's a really good sign that we're on to the right track here. And then from our point of view, really it's only a matter of time until the big bad voodoo daddy stuff, in this case the problem with the optic nerve, comes around in our favor. So the hallmark of a successful nutrition program is that the person undergoing the program feels better every couple of weeks. And if she keeps a weather eye out for that, I think we'll be headed in the right direction.
Sounds good.
Sounds good, Robin Hood. All right. Hey, by the way, how did you find out about Longevity? How did you get involved with the company?
Well, I was with Go Foods. And
oh, you were?
Yeah, and then Go Foods was bought, and so then I re-educated myself with Dead Doctors Don't Lie. And
yeah, what'd you think?
He's fabulous. He knows what he's talking about, and I've been listening to your shows and some of your stuff, and so I'm excited.
Well, yeah, your daughter should be too. I'm excited for you too. And remember, the proof of the pudding's in the eating. The medical nutrition program should be painless, and it should produce noticeable and measurable, not vague and, oh, my God, maybe. Right. But it has to be noticeable and measurable improvement inside a couple of weeks. And once we've hit that target, really the rest, as they say, is just, a little bit of time, and life is good. Appreciate your call, Lillian. Now go out there and get your health back. Let's stay in that part of the country. Let's go to Montana and talk to Josh. Hey, Josh, thanks for the call. You are live.
Yes, Dr. Glidden. Thanks for taking my call. I've got cystic fibrosis, and I talked to you in May, and now I'm calling you back, and my lungs, they're getting worse and worse. What are we doing wrong?
Okay, so has anything gotten better and better?
Well, I'm off of my pancreas. That's been really good. Ever since I quit eating gluten and quit eating those bad foods, it's gotten better. But my lungs just have not improved. They just get worse. And that's
all right, Josh. All right. I'm glad you called. I'm sorry for that experience. We're up against a hard break. You stick with me. I'll bring you up back on the other side, and we will talk this out. Stick around. Ladies and gentlemen, I'm Dr. Glidden, and this is, well, you know. Welcome back, everybody. Dr. Peter Glidden here, your steadfast advocate for health. Hope you enjoyed the cartoons that we put up on the live video stream. Check it out, the drgliddenshow.tv. We're talking to Josh in Montana, who's a cystic fibrosis sufferer, and who's not experiencing any improvement in lung function with longevity. Josh, are you still with me?
Yes.
Okay, so again, I just want to make sure that there's nothing else that's been really dramatic that's improved with longevity: mood, energy, appetite, sleep, arthritis, blood pressure. Nothing else. I mean, did you have anything else besides the lung problem before you started?
Everything is same. My arthritis, I got some in one foot, and I have to be on 800 milligrams ibuprofen twice a day to keep it down. It just, I don't know, it won't go away.
All right, then
we're doing. Get worse back.
Yeah. So we're doing something wrong here because cystic fibrosis is one thing because that's been baked into the cake since birth. And cystic fibrosis, muscular dystrophy, the older that you are when you start the program, these things take, a long time to resolve. But I don't expect an arthritic condition to take a long time to resolve. I don't expect a blood sugar condition to take a long time to resolve. I don't expect a blood pressure issue to take a long time to resolve. So given the fact that the arthritis is hanging fire, that can only speak to one of two things, one of three things. Either you're not taking enough of the supplements, you're not taking the right supplements, or you're not absorbing what you're taking. So we need to break this down. I need to go over this with you one supplement at a time. Are you up for that?
Yes.
Okay, great. Really, really great. So first things first, how much do you weigh?
135 pounds.
Okay, and have you eliminated the 10 bad foods?
The gluten for sure, the other stuff not. It's tough, but the gluten is definitely out.
Okay, so when you cheat with the other stuff, what is it that you cheat with?
Margarine sometimes.
Yep.
And chocolate.
Okay, what about oil?
Oils, it's pretty good. I'm pretty good with that.
So you stay away from oil?
Yeah, I try to stay away from it.
And so you don't have salad dressing, right?
No, I don't eat it. I love ranch, but I quit eating it.
Yeah, I loved ranch too. That was a hard thing to give up. I feel your pain. And of course, no fried food, right?
Nope, no fried food.
Okay. And so what'd you have for breakfast this morning?
I had 2 scrambled eggs with a gluten-free bun and some nitrate-free turkey.
Okay. And how did you cook the eggs?
So I could put my hand on the plate, and my mom scrambled them up for me and with some butter.
Okay, so you cooked them with butter. All right, very good. Okay, so what longevity supplements have you been taking, and how do you take them, and how frequently do you take them? Or give me the list one at a time.
Well, I take those those fish oils, whatever.
The fish oil caps. How many of those a day do you take?
I take 9 of those a day.
Three times?
Yes.
Okay,
I take selenium for 3 times a day.
Yep.
And I take them without food. I try to take them between meals.
Good job.
I take calcium. I've got a bottle of this. I take a tablespoon in the morning and at night. Dr. Wallace put me on those CM capsules for inflammation. I take 3 of those 3 times a day. I take a killer biotic for infection. I got them from Longevity. 2 of them a day. And I take colloidal silver, inhale it, 12 milligrams a day. And I take garlic. I eat garlic. And still I haven't seen that.
Okay, so which form of the calcium is it that you're taking?
It's the liquid.
Is it the Beyond Osteo FX or is it the Cal Toddy?
It's the Beyond.
Okay, and you do 1 tablespoon of that twice a day?
Yes. So it lasts a month about it.
Okay, yeah, that would be correct. Okay, and what about glucogel? Are you taking any glucogel?
Nope.
Okay, and what about plant-derived minerals? Are you taking those?
Sorry about that. Yeah, I'm taking plant-derived minerals. I got 2 bottles for a month, and then I got the Beyond Tangy Tangerine and the Beyond Tangy Tangerine 2.0.
Okay, hold that thought, Josh. I appreciate your call. We'll be back after these messages. Stick around, brother. Here and now, it's timely that Josh should call us today because he may be a candidate for testing, but I'm not sure that he is. I think there's a couple of things that we're missing. So we're talking to Josh from Montana, who has cystic fibrosis, and quite frankly, he's struggling with the longevity protocol. Josh, are you still with me?
Yep.
All right. Okay, so here's the deal. You are not taking nearly enough calcium for someone suffering with an arthritic condition at 135 pounds a month. So here's what I would like you to do as an experiment for 21 days. As an experiment for 21 days to see if it leverages the arthritic pain, see if it makes any difference in the arthritic pain. And look, I know that the cough is of the biggest concern here, but you just have to trust me. Everything is connected. And when you have a weakness in your body, that's baked into the cake like a cystic fibrosis lung situation, because everything's connected, if there's chronic inflammation somewhere else in the body, that's going to have a negative ripple effect on your lungs because the body is going to partition out the nutrients to different parts of the body that are under stress. And given the fact that you've had cystic fibrosis for such a long time, the body's resolution processes, self-regulating, self-healing processes have habituated to that. And they're going to give other systems of the body nutrients before they give it to the lungs if some other part of the body needs it. So the recommendation here is an experiment for 21 days to see if we can gain purchase on the arthritic condition, which when we do, will have a coincidental, a positive effect on the health of the lungs is I would like to see you take 1 ounce of the liquid calcium in 1 ounce of orange juice 3 times a day. 1 ounce, that's 2 tablespoons, 1 ounce of the liquid calcium in 1 ounce of orange juice 3 times a day. I also want you to get the glucogel capsules. The glucogel capsules, and I want you to take 15 a day. 5 with breakfast, 5 with lunch, 5 with dinner. I want you to take 15 glucogel caps a day. I want you to do this for 21 days. I want you to do 1 ounce, continue to do everything else that you're doing, right? And to that program, increase the liquid calcium 1 ounce 3 times a day and a little bit of orange juice each time, and 15 capsules of the glucogel a day. Killer biotic, you can maintain. The selenium, of course, is mandatory. The EFAs are mandatory. Everything else that you're doing is perfect. The only other thing that I could potentially see here would be a circulation problem. But honestly, I think that the lung condition is hanging fire because the arthritis is still problematic. And also, we can't neglect the presence of the Tylenol in your system. Tylenol is a big, bad voodoo daddy. And if I was the king of the world, I would outlaw Tylenol because it has extremely negative effects on your liver. And when your liver is compromised, your hormones are compromised, your immune system's compromised. I mean, everything goes down the crapper when the liver is out of sync. And that much Tylenol is going to be producing, a lot of negativity to the liver. And, I understand pain sucks and you're in pain and you got to do something. And I'm not criticizing your behavior. I'm just underlying what's going on here, trying to figure it out metabolically. So, does that sound like a workable 21-day plan? Does that sound something like you can wrap your head around?
Yeah, I'll give her a shot. But can I get you a story here?
I'm sorry, go ahead.
Can I give you a story here? I think the problem is, I don't know, I'm not a doctor, but what happens is I go to the hospital and within a day, when they put IVs on me into my blood, I'm good again. But when I come home within 2 months, I'm bad again, and they put me on oral antibiotics, and nothing seems to help. So I'm wondering if it's not that I don't absorb it or something.
Well, the antibiotics for sure are going to knock out your intestinal tract's ability to be healthy. So when you go to the hospital and they give you intravenous therapy, what do they put in the IV?
Well, they put antibiotics in. They're very high doses.
So every couple of months you'll go for intravenous antibiotics?
Yeah.
Okay, so then you need to be taking a very aggressive nutritional supplement, Flora. You need to be taking probiotics in aggressive amounts. And Youngevity has really good probiotics, but the probiotics that you need because of your intravenous antibiotic use, Youngevity does not have. So give us a call at my office, and my office manager will tell you which ones to get. That number, 855-347-3696, extension 2. That's 855-347-3696, extension 2. I think you've hit the nail right on the head, Josh, because, antibiotics, oral antibiotics, have a clinically verified net negative effect on the health of the intestinal tract, and it's the intestinal tract that absorbs nutrients. And then if you take intravenous antibiotics, it's going to upset the apple cart even further. So I think that you may be onto something. But nonetheless, as an experiment for 14 days, 21 days, I'd like you please to take the glucogel, take the extra calcium, and just see if it gives you a leg up, pun intended, on the arthritic problem in your knee. And call my office and we'll hook you up with a really super high quality, like knock your socks off, probiotic that will in fact help you get back on track after having so much antibiotics in your body. Does that make sense?
Yep, I'll give her a shot.
All right, Josh, I appreciate the trust. I appreciate your phone call, but most importantly, I appreciate you hanging in there when the going got rough. A lot of people would have, said, oh, this doesn't work, and I'm just throwing it away. But, smart people people who have a clue, people who can think things through, understand. Well, I see other people getting better. I see other people calling in. So what's my problem? What is it that's different about my situation that sets me apart from everybody else? Well, intravenous antibiotics 6 times a year is a significant stress to the digestive tract, and of course it's the digestive tract that's involved with the absorption of the nutrients. And remember, folks, when medical nutrition fails, it's either because you're not taking enough or you're not absorbing it. Or, you're taking the wrong stuff. You've got a blood pressure problem and you're taking the digestion pack. Or you've got a blood sugar problem and you're taking the bone and joint pack. It's the wrong pack. So you got to make sure you're taking the right stuff. Josh was 80% good in what he was taking. But you also have to be taking enough appropriate for your body weight, and then you have to be maximizing its absorption. And in his case, I think he's absolutely right. It's the antibiotics that are smacking him all around. Let's go to Minnesota and talk to Vanessa. Hey, Vanessa, thanks for the call. You are live.
Good afternoon, Dr. Glidden. I'm a new listener, and I have lots of questions, but I'm just going to ask you one today.
Well, we've got time today. I've got time.
Okay.
So go ahead.
All right. So I'm pregnant, and there's been a couple things along my pregnancy that I've struggled with. I'm currently seeing a midwife who's also a naturopath, and at 28 weeks, they wanted to give me the Rogan shot, and I told them I wasn't comfortable with it, and I went and researched, and I found out that there really isn't any point to do it during pregnancy. But now my question is, do I absolutely need to do it after pregnancy if the baby is Rh positive, because I'm Rh negative? And if there's other methods or options to prevent or reverse sensitization if in the event that actually happens.
That's an excellent question, and I wish I could answer it. That is completely outside of my domain. However, right, it's a great question. And one would assume that the obstetrician, whether they're an MD obstetrician or a naturopathic obstetrician, would in fact know the answer to that question. Did you ask that question to the person managing your pregnancy?
Yep, and actually I meet with different midwives, and I talk to 2 different people, and I asked what the negative effects were, and they didn't really give me a lot of information, and that's kind of when my faith in the practice started weaning a little bit. I'm like, oh, well, they're just giving me the normal
the party line, right? Because they don't want to be sued. Yeah.
Exactly. That's what it comes down to. So I didn't ask them specifically. Well, I did ask if there's other things, and they said no. But after doing a lot of research, it seems like the percentage of people that are helped by this, it's almost like a vaccination of sorts, is very, very small, like just a couple percent. And there is a lot of negative effects there's possible things that could happen if I take the shot that would endanger me and or the baby, and I just don't know.
You're absolutely right. So I tell you what I'm going to do, because I hate not knowing things, and you would think that I would know this, but I don't. So I'm going to find an answer for you. I have a number of naturopathic colleagues who are obstetricians, and they've been doing it for 30 years, very well respected in the industry. I'm also going to talk to Dr. Wallach about this. So give me a couple of days. What day is today? Today is Wednesday. Tomorrow is the last day of the show of this week. So why don't you give me a couple days? Call me back on the show on Monday. Can you do that?
Yeah.
And I'll answer this specific question for you after I've sourced it from my colleagues. I'll have a much more better answer for you on Monday.
Sure.
All right. So that's that. What else can I help you with?
So then about the same time, 28 weeks, they wanted to do the gestational diabetes test, which basically just drink a bunch of sugar, like 32 grams, and then they do a test to see how my body metabolizes the sugar. And in common sense, it just doesn't even make any sense to me, because one, I don't eat a ton of sugar in general in my diet, and two, from what I could tell, these results aren't like 100%. It's kind of like 60%. Like if I did it one day, it'd react differently than if I did it a different day. So when I turned it down, I had to sign a waiver, of course. And they asked me to test my blood sugar 3 times a day for a week to see how my blood sugar is during the week. And I'm an average person. I eat pretty healthily, and I'm just like, I don't even know if this is, I've never had any issues with sugar, so I'm not sure if this extra testing is absolutely necessary.
Well, it's not a bad idea to get an understanding of this, but I'll tell you a better way to handle it. And this is inside of the domain of the stuff that those doctors don't know. And I know this because I learned it from Dr. Wallach, and so I'm glad that you called. You know, and you're absolutely right that when you're involved in a private practice with any type of a medical practitioner who is licensed in your state, there are all of these legal things that come up. And half of the stuff, half of the testing that physicians have their patients do isn't to help the patient. It's to help the doctor not get sued. So I have a lot to say about gestational diabetes. I've got some really good insight and advice for you. So stick around. This is a hard break. I'll bring you right back up when we come back, Vanessa. I appreciate your phone call. Check out the live stream, folks, at drgliddenshow.tv. Better yet, check out the website, drglidden.com. Finishing up today's show talking to Vanessa in Minnesota, who has nothing but interesting questions. Vanessa, are you still with me?
I'm sorry?
Are you still here? Okay, good.
Yes, I'm there, yep.
All right, so type 2 diabetes, whether it's normal, you know, it occurs normally, or it's gestational, occurs because of your body has run out of minerals, and minerals are necessary for the metabolism of blood sugar. And so what happens is most people are minerally deficient anyway. Well, not most people. Everybody is minerally deficient because the minerals that the body needs to work optimally are not present in the food supply. They're just not there. I don't care how organically you eat. I don't care how good your diet is. I don't care how many servings of fruits or vegetables you have every day. You are minerally deficient, period. Everybody is, unless they're supplementing. So if your body, you know, needs this much nutrition, if it's kind of like a gallon bottle that has to be filled all the way to the top, most people's mineral stores are less than half. And then you get pregnant. And what happens? Well, the baby needs minerals too. But now the baby starts to rob your minerals from your mineral stores, and so your minerals enter into a critical zone. And so now you become minerally deficient because of the presence of another body inside your body competing for the same minerals that your body wants. And so that drives gestational diabetes. It's a mineral deficiency. It's 100% mineral deficiency. It's got nothing to do with anything else. So you need to be supplementing with minerals, especially when you're pregnant. Everybody needs mineral supplementation. If you take the right stuff, you know, during pregnancy, you're not going to get gestational diabetes. You're not going to get preeclampsia. You're not going to become eclamptic because your body's going to have all of the stuff it needs to maintain its structure and function throughout the pregnancy. Now, all birth defects, as far as we're concerned, happen in the first trimester, and most birth defects, if not all, are rooted strongly in nutrient deficiencies. So in a perfect world, we would recommend women for 6 months before they even think about getting pregnant to nutrify their bodies optimally, so that at every second of the time when the fetus is developing in utero, it has the nutrients necessary to, you know, grow properly, right? So how much do you currently weigh right now, and how far along in the pregnancy are you?
I weigh almost 140 now, and I'm 29 weeks.
Okay. So here's what I would recommend you start with. And are you not doing any longevity supplements yet, are you?
You know what, my mom's been taking the minerals for years, so I've kind of had them on and off in my fridge, but I haven't ever really done, I didn't even know the 90 for life stuff. So I'm just getting on to that regimen.
Yeah, it's a good regimen. Better late than never, especially for the health of the child, right?
Yeah, I wish I'd known more before I got pregnant, but it is what it is. But
it is what it is, and that's okay.
Really low on is iron, so that was my last question, is if I get on to
yes, the answer is yes. You will not need extracurricular iron
Okay.
when you get
the
on
stuff
board.
I'm taking now is not really doing anything.
Well, that's a good thing to talk about, because what you're doing, so iron is one of the 90 essential nutrients.
Mm-hmm.
And you need a number of the other nutrients need to be present in your body so that your body can metabolize the iron and use it.
Mm-hmm.
So if you just throw iron into the body, into a nutritionally deficient pool, your body's going to be able to metabolize it poorly, if at all. I've had patients that have been on, iron supplements for 15 years, and they get on longevity, and in 3 months, the iron deficient anemia disappears. And so, so the recommendation here for you would be at 140 pounds per month. 1 Healthy Body Start Pack 2.0 liquid. 1 Healthy Body Start Pack 2.0 liquid. 3 bottles of selenium. 1 bottle of plant-derived minerals. And 1 bottle of something called Sweeties. That's 1 Sweeties, 1 plant-derived minerals, 3 bottles of selenium, and 1 Healthy Body Start Pack 2.0 liquid. Plus, of course, if you've listened to me long enough, you'll know that we advocate everybody stops eating 10 foods, and you can get that list for free on my website.
Doing that.
All right, great. I wouldn't worry about the gestational diabetes thing as long as you're taking the Sweeties and the plant minerals and the rest of it. Nutrify your body. Give your body the stuff it needs. And, give me a call back on Monday. I'll have the inside scoop on, the ROGAM stuff that they want to give you. I appreciate your call. Thanks so much. We're out of time. Ladies and gentlemen, live long and prosper. God willing, and the creek don't rise. I'll see you next time.